The Engage training programme, which is Ireland's national men's health training programme, was published in 2011. At that time, there were 5 modules incorporated into the overall training, and currently there are 6. One of the original 5 modules is entitled The Rules of Engagement, and this module details 12 strategies for good practice when engaging men in health and health-related services. Since 2011, there has been a body of literature that has also identified good practice when engaging men in their health, and this has also been summarised in this presentation. Effectively, these rules underpin the creation of gender-sensitive services for men and are really useful to practitioners and indeed policymakers when striving to improve the health of men. The first of these rules is to adopt a positive approach to men's health work. We know that men work best with those who believe they are people of worth rather than a problem to be solved. Many service providers view working with men as being difficult, as they are hard to reach, and some adopt an attitude of blaming men for the health outcomes that they experience. And we know through our work with men that it is really important to adopt solution-focused activities that develop a non-deficit approach. And as a service provider or program provider, it's really important that their own motivation and their value base for working with men is explored, just to question whether they do subscribe to this deficit-based model of men's health, and are they in a position to adopt a solution-focused and positive approach to men's health work. Because unless this particular approach can be adopted, any attempts to work with men is going to be very challenging, both for the service providers and for the men themselves. We also know that it's really important to provide innovative services that will appeal to men, and much time needs to be given to defining what an appropriate hook might be for the particular target group of men. So it's really important to adopt an opportunistic approach to service provision for men. We do know that there are window periods when men are more likely to access services. We know that when men become fathers, for example, that's a really opportunistic time to engage with men around their health, because obviously they feel more responsible for their health, given that they now have a dependent in their lives. We also know that many men have an innate desire to feel useful and to help others and to be a fixer, and certainly when working with groups of men, there's real value in promoting this peer support so that men can not only be supported by the group but are offered opportunities to support others in the group. Issuing men with an invitation and a challenge can also be appealing to some men, and this might be with respect to making something, achieving a particular health outcome over a particular period of time. And presenting issues in terms of fitness and good health may also give men an opportunity to admit to ill health at particular times in their lives. So something that has worked quite well, particularly as an initial hook, and maybe to give men an opportunity to learn about other services available to them, is to initially invite men in the door for an opportunistic health check. And we know that when we say things like a men-only health check that is free or very cheap, appeals to men. But also using incentives. So for example, we have provided lunch to encourage men to attend a service when they were attending at Marts. So depending on the particular target group that you're hoping to engage with, it's really important to consider what this hook might be that might bring in the door, and how you might develop an innovative service around that hook. The third rule of engagement is to ensure that services are really easily accessible for men. We know that men use services less frequently than women, and this has serious implications for their health. So therefore, when providing a service, we need to ensure that we're not actually putting barriers between the man and the service due to simple things such as accessibility. So when planning a service, providers should consider, if there's car parking, is the car parking costly? Is there access to public transport? And actually consider the journey of the man to the service. Is it also possible to possibly provide the service outside of normal working hours? Again, the provision of services only within working hours may provide a barrier to some men who have to choose between working and possibly being out of pocket if they go to this particular service. There is also some really good evidence where programs have been brought to men, and programs can piggyback on an event or a service that men attend anyway. So for example, we have done work here with our social welfare office where we've brought health checks to the social welfare office on the days that men would be coming to receive a payment for being unemployed. We also have a really good example of a Farmers Have Hearts project where again health checks have been brought to marts where men are coming to anyway to engage in livestock sales. But also there's some good evidence of community-based interventions where, community organisations such as sports clubs or men's sheds are hosting health programs. Something to try to avoid when considering the accessibility of the programme are waiting lists or complicated referral procedures. This can cause frustration for men and they simply stay away. So as much as possible, simplify the pathway to your programme and again, where possible, remove cost barriers. There is good evidence now at this stage that if the initial service is free and men get an experience and a positive experience of that service, they are more inclined to pay for that thereafter. And also by offering the programme for free initially, it gives them a chance to check it out without the risk of being out of pocket or having potentially wasted money that they really need for something else in their lives. So cost is important, and certainly in any marketing strategy that we've done, it's really important that the word free is in big bold letters so that men can see that they don't have the risk of paying for something when they're not quite sure what they're going to get. The expression first impressions last is very true for men with respect to their initial contact with the service. So it's really important that any marketing or any initial time point that the man engages or learns of the service is done well. And you'll see that there's quite a lot on this particular slide that you can draw upon in learning how to do that. And I'd like to draw your attention to a few of them. And the first is around the importance of in-person outreach where possible. So who might be the gatekeepers for men? So who are the people that men might trust and listen to? And we know that men often listen to their partners and their wives. They often listen to their GPs and other health services for whom they have respect. They listen to their friends and their peers, and they may also listen to other members within the community who are reputable. So where possible, capture the different types of gatekeepers available to the men that you're trying to target, and see if you can encourage them to advocate for the programme and market it in person whenever they get a chance. I spoke about men themselves being trustworthy allies of other men, and therefore snowball recruitment is really, really important and can be powerful for engaging men in health-related activities. So if you have a man who's had a positive experience of a programme, or you've had an opportunity to encourage him to come along, it's really important that you remember to say, and bring along some of your friends. They're more than welcome. In any kind of formal marketing of the program, then, it's the imagery that's associated with the service is really important. Again, it needs to be a positive, respectful image of a man that your target group can relate to. I'll speak about Men on the Move in a while, and I know that when we were preparing the literature to market the program in communities, service providers were really clear that the imagery couldn't be something we'd taken from a stock database. It needed to be an image of a real Irish man to whom our target group could relate. Also, in the marketing, you've got to have a very clear outline of what the service and the program is, and detail the tangible outcomes that men could expect from participating in this program. So again, they need to know, well, what am I going to get for my time and possibly money by attending this particular program? And as I said, where possible, if this can be communicated in person, so what we would always do on any marketing strategy is ensure that there are contact details of somebody to call, and that that service provider is aware of using positive language, respectful language, encouraging language, and giving a very clear outline of the program and ensuring that the man understands the tangible outcomes he can expect from attending. Creating a male-friendly environment is really important for the men when they actually walk in the door to your service. It's got to be open, it's got to be friendly, and particularly on the registration evening or on the first day of the service, we would always ensure that there are several service providers there so that there are enough of us to shake a man's hand and have a one-to-one conversation with as many men in the room as possible to really create a sense of trust, safety and welcome, and always celebrating the fact that the men actually showed up. Again, if there's are to be posters or imagery around the room, ensure that they are positive, make sure that there's appropriate reading materials there, which all give out a very clear message that men are welcome and it is important and necessary for them to be there. And where possible, ensure anonymity and privacy. And it is important to support men or to protect them from losing face in any way. And we have done health checks in very large community venues, and through the use of very simple screens or the positioning of tables to create barriers, we've been able to manage, even within those public spaces, to create a sense of privacy and anonymity for men, where they feel they can get some time that is just all about them, between them and the service provider. And again, all of these small and some very large and overt things that we do send a very clear message to men that it is an environment in which they are welcome. I suppose Engage, the National Men's Health Training Programme in Ireland, was really developed to build capacity among service providers to work appropriately with men and to ensure that the services are gender sensitised. So this rule is really, really important, because if the service provider or the facilitator who meets and works with men isn't equipped to do so appropriately, then it's probable that the outcomes that you hope to achieve from your service will not be realised. So in much of the work we do, we spend an awful lot of time on training the tutor, for example, on the physical activity programme, who'll actually be working with the men week in and week out. It's really important that this person is highly skilled, has the capacity to promote inclusiveness, create a safe environment, and is capable of allowing men autonomy within the program or the intervention that they're involved in. So there are a number of key skills that we would look for in a tutor to ensure that they can create a positive group dynamic within a group of men. And actually these skills are more important than the sex of the facilitator. We'd have a number of programs throughout the country in Ireland where there are women leading male-only groups, and there are also men leading male-only groups, and the experience of the men in those groups is no different, because the facilitator is capable of working appropriately with the men. And I suppose the potential authority bit that can happen between a group leader and the group in a service is something that is particularly relevant, I think, to working with men. And I think it's very important that service providers actively seek to break down these power differences so that men can have a sense of autonomy within the service, and that the service is there for them as opposed to them having to follow a very strict protocol. While this rule overlaps to some degree with some of the others, such as adopting a positive approach when working with men, I think it's really important that communication is singled out as a rule on its own, because in every interaction that a service provider has with men, how the communication happens is really important. So the language should not be deficit-based. It should again reflect the positive approach that the service provider has for the work. It should be respectful, and the purpose of the communication should always be around developing a rapport with service users and building trust with the service user so that they will continue to engage. In some instances, service providers need to try to be comfortable with the male approach that, may be at odds with their own natural communication approach. It may be more boisterous and loud, and banter and fun and celebration has been, documented as being very important and integral to health-related work for men. And again, this might manifest in a different way than it would for women. So it's important that service providers try to be comfortable with this and allow that male approach to organically happen. And I spoke earlier of the transition times in a man's life where there are opportunities to engage. So if the hook is around fatherhood, then yes, language that's focused around their child is relevant in terms of communicating with them at that time in their life. And there's an awful lot of evidence at this point about the value of adopting a hands-on approach when working with men and making sure there's a clear focus to the work. So in Ireland and elsewhere, men's sheds have proliferated. So these are spaces where men can be with other men in a community setting and be working together on projects. And one of the, I suppose, mottos of the Men's Sheds Association is that men often talk shoulder to shoulder. Now, while this is true for so many men, I would like to flag that the Men's Development Network here in Ireland have vast experience spanning the last 2 decades of working developmentally with men, whereby men would sit in circles and they would communicate and support one another about very meaningful problems and issues that are happening in their lives. So I wanted to bring that in, because while adopting a hands-on approach is a really, really useful and relevant rule to engaging men in their health, it would be remiss of me to leave it there and not to mention that men are capable of working developmentally. If you'd like to learn more about that, you can check out the Men's Development Network website. So with respect to working hands-on with men, there is a lot of evidence that many men tend to respond better to programs that are task-orientated and they meet a tangible need. And there's some really good examples of these. As I said, the Men's Sheds. You may have seen the video earlier on the Larkin Centre where there's a community garden. These programs tend to have a very high level of participation, so these men are doing things and they have a very specific purpose, and they have a very clear and concise description of what they want to do, why they want to do it, and how they want to do it. So as you can even hear in the tone of my voice, it's very directive. There's a purpose, there's a process to get to an endpoint in a particular time. Again, for service providers, it's really important that it's made explicit to them what is expected of them at the outset, and to regularly review whether that's been achieved or not, and to openly discuss that. And I know that this is very much a pattern that happens in the men's sheds, for example. But also, as I've mentioned earlier with respect to another rule, it's really important that the service providers our service users have a really good understanding of what they're going to get from attending the particular program. So it could be weight loss, it could be improved physical fitness, it could be better mental health, it could be social interaction, it could be giving back to the community. But it's really important that they're very clear that they know what they're going to get from engaging in the particular service. As you may know, there are some attributes of the traditional male stereotype that are not conducive to good health. For example, men have been encouraged to be strong, to be independent, to see vulnerability as a sign of weakness, to not ask for help. And much of these particular attributes contribute to delayed help seeking, risk-taking behaviours, and other poor health behaviours that negatively impact upon men's health. So where appropriate, it's really important that service providers challenge male stereotyping, and from the outset encourage men to strive and understand and respect difference, so that they can possibly broaden their view on the many different ways it is to be a man. And I suppose strategies that can support men to do this is to ask them to imagine walking in another man's shoes, to promote listening without prejudice within the service, and I suppose to not ask anyone to do what they haven't done themselves, and to always ensure that men participate at their own pace and that they don't have to compare, they don't have to push themselves and be strong or be good or be competent or be able, but allow them to be where they're at and for others to respect that. And it's really good practice to consult with and involve service users in the development, planning and delivery of a service. So where possible and at all levels, involve male clients in shaping and determining the most effective strategies to achieve a service or a program outcome. And the manner in which the services are delivered should be determined locally. So it's really important, as you probably know, to ensure that their voices are heard, so that, I suppose, the planning is cognizant of some of the barriers that men are facing that the service providers might not even be aware of, and that men should really be included in all aspects of the service delivery. And I know that certainly in some of the work that we've done here in Ireland, initially men show up for a programme that's been offered, and when the men are in the door and they're feeling more comfortable with the service, then space is created to allow men to shape the direction of that service. So it's not always possible maybe to get the men initially to be part of the development of the service, but certainly when they're in the door and there's been a degree of trust created, it is really wonderful to see men shaping the service and the programme for themselves. And the one thing I would always say to service providers is that if we see and view men as an asset and a resource to the service, more is going to be achieved by pooling the assets of the service providers and the service users together in terms of achieving the outcomes of the service itself. Yeah, I think this rule is really, really important at any stage of where you are with working with men, whether it's your first attempt to engage men or whether it's your 10th. I think it's really important to plan appropriately and realistically. And I would start with the 4th or 5th point here, And I'd say first of all, you really need to give a lot of time to the resources that the service is going to require. And I wouldn't underestimate that marketing piece and that initial contact piece with men, and just how long some of those conversations will take and how many of them that you will actually have. So I think it's really important that the resources required to deliver the service are considered well at the outset, and that you start small and think short term, and then you build slowly. That you initially think, how can you get men to come in the door, and then work on the relationship, build trust, build rapport, and build slowly from there with men as allies and partners in the planning and delivery. I think it's really important that, particularly in men's work, you focus on the quality rather than the quantity in terms of the number of men who come through the door. I know that when you look at the number of women who show up generally for a service, if the expectation is something along those lines for men, well, I would argue that the bar is set way too high there. I think that you've got to be more realistic and expect half to a third of the number of men that will show up. And that's why I would say, if you're being realistic about that, if you're expecting half to a third, or maybe even less, a quarter of the number of women you would expect to show up, don't be put off by that. I've shown up and there have been 4 men in the room. I've also shown up and there have been 44 men in the room. But I would never be put off by the smaller numbers. It's a real achievement to get men in the room, and you can build from there. And where possible, provide a range of programs, because again, different programs may appeal to different men. In the field of men's health work, health promotion is relatively new for men, and therefore the body of literature, while it's definitely been growing over the last few years, it is still fairly small, and we have much more to learn in terms of how to effectively engage men with their health and to what effect. So this final rule of engagement from Ireland's Engage training programme is that service providers should always strive for higher standards of best practice in the future. So for example, any health-related work for men should undergo an evaluation process that looks at the outcomes of the intervention, but also the processes involved in terms of bringing about those outcomes, so that we can use this information to educate and inform others of how to work with men. Also, men's health work is really underpinned by strong strategic alliances and partnerships with other organisations. And one really good example of this in Ireland is National Men's Health Week, whereby initially it was led predominantly and often solely by the Men's Health Forum in Ireland. But now, to date, there are over 70 organisations who promote men's health during National Men's Health Week. And these partnerships have grown and have strengthened over the last 10 years in this country. And currently we have organisations such as the Cancer Society, the Heart Foundation, national sporting organisations, all advocating and celebrating men's health during that week. And I think the support networks is also really important, and it's something that I work quite hard at in my own work, is to stay connected with others, to allow for opportunities for sharing information through the written word, through human contact, small group gatherings where we meet regularly to reflect on our work and to learn from others. And I suppose even this piece that I'm doing now in this presentation is part of that process. And as I said earlier, since 2011, there have been a number of good examples of effective practice when working with men. And here is a summary of the evidence garnered from a number of those studies. We know that now that men are more reliant on exercise than nutrition to maintain a healthy weight. We know that men prefer community settings or sport clubs to healthcare settings. We know that interventions should be based upon behaviour change theory and include family and friends. We know of the importance to adopt a strengths-based approach that revolve around creating safety, trust, rapport and meaningful relationships with men. We know of the importance to use strong positive messages that encourage men to engage with services without amplifying shame or blame. We know it's important to connect positive masculine identities with being healthy and productive. We know that our work ought to reflect the wishes of men to maintain control and to engage with services on their own terms and in their own way. And we know of the importance to offer opportunities for men to share their stories and to show common challenges, because this creates an environment where men can offer and foster peer support and create a community of mutual help. And as I come to the end of this particular presentation and I reflect on the rules of engagement that I've presented, I'm really struck by the fact that so much of what I said might appear to be simple common sense, and that none of what I've said is rocket science. In fact, it's good practice for engaging with any human being. And what I would encourage you to do and to take as a key take-home message from this particular presentation is that you would simply use them as a guide and a checklist to check against any service or program that you're thinking of offering to men. How have I approached this work? How am I marketing this work? How am I communicating this work? How might I be able to challenge male stereotypes? How might I be able to create an environment where men feel welcomed? What tangible things might I do to create trust and safety so that I can build upon this work and ensure that men are part of the planning and delivery of the service in the future? And I think some of these questions are really relevant to us as service providers to reflect on the how and the why of what we're doing ever before we go out the door to do the work.